Are you tired of feeling like your own knees are working against you? That constant ache, that morning stiffness, that hesitation before a simple flight of stairs. For too long, you felt trapped, limited, even a little bit betrayed by the very joints that are supposed to carry you forward. It's a frustrating cycle of discomfort that can make you feel powerless. But what if the key to unlocking that freedom wasn't found in a complex surgery or a cabinet full of pills, but was already built into your body, just waiting to be awakened? I'm here to tell you that the cycle of stiffness and pain doesn't have to be your permanent reality. The breakthrough you've been waiting for doesn't require a gym membership or any fancy equipment. It starts right in your own living room with a simple chair and just 10 minutes of your day. Today, I'm going to guide you through a specific, science-backed chair exercise designed to reactivate your knee's natural support system. This isn't about a quick fix, it's about a fundamental reset. By the end of our time together, you will have the foundational tool to start erasing that deep-seated pain and reclaim the fluid, confident movement you thought was lost. Think of your knee joint like a sophisticated suspension bridge. The bones are the towers and the roadway, but the muscles surrounding it, especially your quadriceps on the front of your thigh, are the crucial support cables. When osteoarthritis or chronic pain sets in, it's often because those cables have weakened or forgotten how to engage properly. The brain-to-muscle connection falters, a process called arthrogenic muscle inhibition. This leaves the joint vulnerable, bearing weight unevenly, which leads to more wear, more inflammation, and more pain. It's a vicious cycle, but we can break it. The exercise we're doing today is specifically engineered to reboot that connection, to remind those dormant stabilizer muscles of their primary job, protecting your knee. We're going to wake up your body's internal brace. All right, let's transition from the why to the how. Let's get you set up for success. First, find a firm, sturdy chair. A dining room chair or a kitchen chair is perfect. We want something stable that won't rock or sink. Please avoid a soft couch or recliner for this, as they don't provide the proper support for your posture. Sit right on the edge of the seat so your back isn't resting against the chair back. Plant your feet flat on the floor, positioned about hip-width apart. Sit up tall, as if a string is gently pulling the crown of your head toward the ceiling. Relax your shoulders down away from your ears. You can place your hands lightly on the sides of the seat for balance if you like. This is your foundation. Take a deep breath in and let it out. You're ready to begin. We're going to perform a movement known as a seated isometric knee extension, but I like to call it the foundational awakener because that's precisely its purpose, to awaken and recruit those crucial stabilizing fibers in your quadriceps that have been taking a prolonged nap. We'll do this together, step by step, focusing on quality over everything else. Step 1. The mindful lift. Let's begin with your right leg. Keeping your back in that nice tall posture, I want you to slowly, mindfully begin to straighten your right knee. As you do this, your right foot will naturally lift off the floor. Now here's a key detail. As you lift, gently pull your toes back toward your shin. This action of dorsiflexing the ankle further activates the chain of muscles up your leg and ensures we're targeting the entire quadriceps group. Continue extending your leg until it is as straight as you can comfortably make it. This is vital. Go only to your pain-free limit. We are not forcing a locked knee. We are seeking a straight line from your hip to your heel, but comfort and control are paramount. If you feel a pinch or a sharp pain in the joint, you've gone too far. Simply back off a few degrees to a position that feels strong, not strained. Step 2. The isometric engagement. Now, here is where we place our focus. With your leg held in that extended position, I want you to consciously and forcefully squeeze the large muscle on the front of your thigh, your quadriceps. To ensure you're doing this correctly, place your fingertips on the inner part of your thigh, just above your kneecap. When you contract the muscle, you should feel it tighten and become rock solid under your fingers. It might even cause your kneecap to shift upward slightly. This firm, tense sensation is the golden signal. You have successfully engaged the target. This is the awakening. Step 3. The strategic hold. Once you've achieved that powerful engagement, hold it right there. Don't forget to breathe. Inhale deeply through your nose and exhale slowly through your mouth. We are going to maintain this muscular squeeze for a full 5 seconds. Let's count it down together, focusing on that muscle tension. 5, 4, 3, 2, 1. This isometric hold, where the muscle is working without the joint moving, is incredibly therapeutic. It builds raw strength and stability without the repetitive friction that can irritate an arthritic joint. This is the core of the exercise. Step 4. The controlled return. The work isn't over yet. Now, with the same deliberate slowness you used to lift, begin to lower your foot back toward the floor. Resist gravity. Don't let your leg just drop. Imagine you're lowering something fragile. This eccentric or lowering phase is critically important for building functional strength and control, which is exactly what your knee needs for daily activities. Gently place your foot back down. Take a brief moment to feel the sensation in your leg before you begin the next repetition. That is one complete repetition. It may seem simple, but when performed with this level of intention and focus, it is profoundly effective. You are not just moving a limb, you are re-educating your neuromuscular system. You're sending a loud, clear signal from your brain to your knee. I am here to support you. Now, I know that one size does not fit all. Your pain level and starting point are unique to you, and this exercise is wonderfully adaptable. The goal is to challenge the muscle, not to provoke joint pain. Here is how you can tailor the foundational awakener to meet you exactly where you are. Modification 1. The neurological primer, the quad set. If lifting your leg at all is uncomfortable or currently out of reach, we start even more fundamentally. Remain seated firmly in your chair, both feet flat on the floor. Without moving your leg or lifting your heel, focus all your attention on the front of your right thigh. Now squeeze that muscle as hard as you can. Use your hand to feel it contract. Hold this intense squeeze for 5 to 10 seconds, then fully relax. Repeat this 10 times on each leg. This is called a quad set, and it is the cornerstone of rebuilding that brain-muscle connection. You are laying the neural wiring for everything that follows. Do not underestimate its power. Modification 2, the range of motion builder. Perhaps you can lift your leg, but achieving full extension is too much. That's perfectly fine. Perform the lift, but only raise your foot a few inches off the floor, or only straighten your knee halfway. Find the range where you can achieve that strong quad squeeze without any joint pain. Hold it for 5 seconds there. The magic is in the muscle contraction, not the angle of your knee. As your confidence and comfort grow over days and weeks, your range will naturally improve. Modification 3, the progressive challenger. Once you can perform 12 to 15 repetitions of the full exercise on each leg with perfect form and absolutely no pain, it's time to progress. The safest and most effective way is to increase the duration of your isometric hold. Instead of 5 seconds, aim for a 10-second or even 15-second hold at the top of the movement. You will feel a significant increase in muscular endurance. Only when this becomes manageable should you consider the next step, minimal external resistance. This could be a light ankle weight, starting with 1 pound is plenty, or even a resistance band looped around your ankle. Proceed with caution here, and only if the unweighted version is completely comfortable. Knowledge is power, but consistent action is freedom. Let's build your simple, sustainable 10-minute daily practice. Your goal is 3 sets of 10 repetitions for each leg. Here's your blueprint. Set 1.
Perform 10 mindful, controlled reps on your right leg. Then switch and perform 10 reps on your left leg. Rest for 60 seconds. Set 2, repeat the sequence. 10 reps right, 10 reps left. Then rest for another 60 seconds. Set 3, complete your final sequence. 10 reps right, 10 reps left.
This entire routine, with rests, should fit neatly into a 10-minute window. The best time to do it? Whenever you can commit to it consistently. Many find that doing it first thing in the morning helps lubricate the joint for the day, or in the evening to counteract the stiffness of daily activity. This single exercise is your keystone, but it is the beginning of a journey, not the destination. Robust clinical research consistently demonstrates that structured, progressive exercise is the most effective non-invasive treatment for osteoarthritis. Studies published in journals like the BMJ and Arthritis Care and Research show that patients following such programs report up to a 40% reduction in pain and significant functional improvement, often within 8 to 12 weeks. Imagine where you could be 2 months from now by faithfully practicing this one habit. From this foundation of regained strength and stability, you can begin to safely integrate other movements. Gentle heel slides while lying on your back can help restore lost range of motion and flexibility in the joint capsule and hamstrings. Seated leg lifts, straightening the knee without the isometric hold, can build endurance. Most importantly, as your pain decreases, reintroducing low-impact cardiovascular activity like walking, stationary cycling, or aquatic exercise becomes essential. These activities pump nutrient-rich synovial fluid through your joint, acting as nature's lubricant and shock absorber for your remaining cartilage. Movement is the medicine. As you embark on this path, you must become the expert on your own body. Abandon the old no pain, no gain mentality. In the context of joint health, we follow a challenge the muscle, respect the joint philosophy. A deep muscular fatigue is good. A sharp, stabbing, or pinching pain in the knee joint is a red flag. It is your body's communication system. If you feel that, it is not a failure. It is invaluable feedback. Pause, breathe, drop back to a previous modification, or reduce the range of motion. Healing is not a linear sprint. It's a patient, intelligent marathon. Consistency with perfect form will always trump sporadic intensity. 5 perfect reps daily will yield far greater long-term benefits than 50 painful ones once a week. You started this video feeling trapped by a cycle of stiffness and powerlessness. Look at what you've done. You've discovered that your body holds its own powerful mechanism for healing and support. You've learned how to access it with nothing more than a chair and your own focused will. You are no longer passive. You are active. You are in the process of rewriting the story of your knee health. This is about so much more than a single joint. This is about reclaiming your independence. It's about the joy of a pain-free walk in the park with someone you love. It's about the confidence to get down on the floor to play with a grandchild and get back up with ease. It's about gardening, traveling, and embracing daily life without a constant aching reminder. Every single repetition you do is a declaration of intent. It is a vote for a stronger, more mobile, and more vibrant future. You have the knowledge. You have the simple plan. The power is now in your hands and in your legs. Start today. Be patient with yourself. Be consistent. I am absolutely confident that you can do this. This is your first step on the path back to the life you love. Now, let's get to work.